We have Mr. GSK Velu, CMD, Neuberg Diagnostics, joining us on the broadcast. Thank you very much, all of you, for joining us on this very special edition today to discuss India's health mission. And since we are all in the middle of coronavirus pandemic, the focus today, of course, is going to be on India's vaccination policy. Dr. GSK Velu, now, apart from, of course, focusing on vaccinating, the eligible population, the focus, don't you think, also has to be on continuing with this policy of aggressive testing? That shouldn't really go down because remember how the second wave came in as a huge surprise, and India clearly was underprepared. So to ensure that we don't have the same kind of scenario again, because the third wave is inevitable, what is it that should be done according to you?
Like other two panelists talked about, I think vaccination is the way to go to reach the herd immunity. But actually, we have to go back to our basics, which is tracking, testing, then isolating or treating. This cannot be. I think first wave we all learned in a hard way. We reduced the testing. We actually even dismantled a lot of the infrastructure which we created for treating. So I don't think we should leave the vigil out until 80% of the population is really vaccinated. We need to keep the testing, whether it is rapid antigen, RT-PCR, or other home-based testing is also coming. So I think that's the only way. We need to, in fact, increase testing so that if there is an issue coming out, or something like even a glimpse of third wave coming in some place, we can isolate and deal with it. If too many things happen too soon, like what happened in the second wave, then it becomes a big stress on our healthcare infrastructure. So I think testing will have to remain not only today, for the coming years, at least in the next 2-3 years, that will become central to the whole, the management of the COVID pandemic. Once the pandemic has been, we have to first announce we are out of the pandemic. That's the time we can take a little bit eye out of testing. Until such time, the testing using multiple platforms available should carry on across the country. That's absolutely, there should be no lack of focus on testing if for us to manage this pandemic well.
Okay.